In this episode, we'll be breaking down 7 signs your body is giving you that indicate a hormonal imbalance that could be blocking your fertility.
Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we?
Today, we're breaking down 7 signs that your hormones might be working against your fertility and how to recognize the subtle and also not so subtle ways your body might be waving a red flag. So, if you've been trying to conceive and feel like something is off, but don't know exactly what that is, this episode is for you. So, let's get started. Hormones are our body's messengers, and when they're balanced, they are going to help and support ovulation, implantation, and maintain a healthy pregnancy. But when even just one is out of sync, the whole fertility picture can shift. And the trouble is, most people are never taught how to recognize hormonal imbalance unless it shows up as a big diagnosis like PCOS or endometriosis. So think about someone who maybe has unexplained infertility, where labs look quote unquote normal. So today we're going to be going deeper and talk about what you could be experiencing if your hormones aren't supporting your fertility goals. So here are 7 sometimes dismissed or overlooked, but common signs that you may have a hormonal imbalance that's blocking your conception. So, number 1 is irregular or missing periods. Your monthly cycle is your hormone report card. If your periods are all over the place or missing altogether, and ovulation isn't happening consistently, it likely means that estrogen and progesterone are out of sync, possibly some other reproductive hormones. And at the end of the day, without ovulation, there's no egg, and natural conception cannot happen. Number 2 is a short luteal phase, anything less than 10 days. The luteal phase is the time between ovulation and your next period. And if this phase is too short, then your body may not be producing enough progesterone to support a healthy implantation. So it's possible that the early stages of conception is happening, but you don't even know because the pregnancy itself can't stick with proper implantation. And a lot of times people with a short luteal phase, they automatically think, how can I increase my progesterone? And sometimes they go about it the wrong way when realistically, it all starts with a healthy, high quality egg in the follicular phase. Number 3 is mid-cycle spotting or random bleeding. Spotting between periods, especially around ovulation or the luteal phase, can be a sign of hormone fluctuations that are involving estrogen and also progesterone. And these imbalances can affect the uterine lining and egg quality. Number 4 is PMS or premenstrual symptoms that feel out of control. So this could include mood swings, irritability, breast tenderness, or bloating that takes over your life in the second half of your cycle. And no, it's not just a part of being a woman, okay? Society will have you think that this is common and it's just what we have to deal with as women. No, common does not equal normal. And these are really strong signs that your estrogen and progesterone levels are not balanced, and it can interfere with your ability to conceive or even maintain a pregnancy. Number 5 is trouble sleeping, especially before your period. So if you experience sleep struggles, especially in the luteal phase, this can be tied to low progesterone because progesterone has a calming effect on the brain. And if it's too low in the luteal phase, then you may find yourself waking up anxious, wired, or restless. And we all know that poor sleep can add more stress onto the body, which can then cause more hormone disruption. So unfortunately, it is a vicious cycle that can just keep feeding into itself. Number 6 is low sex drive or vaginal dryness. So this is probably one of the more overlooked or dismissed signs of a hormone imbalance because estrogen plays quite a big role in our libido and cervical mucus production, which both are critical for conception. And if you're not feeling that burning desire to do what it takes to create a baby, or if you're noticing dryness around ovulation, then this is definitely a sign that your hormones need some support. Number 7 is hair loss, acne, or unexplained weight fluctuations. So these physical symptoms are your body's way of saying, hey, your hormones like testosterone, insulin, or cortisol might be out of range. If you're noticing more hair in the shower drain, breakouts around your jawline, maybe hair growth in areas that you wouldn't expect, or weight gain that is just not matching your nutrition or lifestyle, then your hormones could definitely be interfering with egg quality, ovulation, or embryo implantation. So, what can you do about it? If you nodded your head in agreement to one or even more than one of these signs, I want you to know this. You are not alone, and your body is not broken, and it is not failing you. It is actually trying to communicate with you through these signs and symptoms. And this is not the end of the road. Hormone imbalances are your body's signals. It's not a permanent diagnosis, and they are absolutely shiftable with the right support. So, this is where functional testing and root cause work comes in, especially in the way that I help my clients. We want to look under the hood of your hormones and look at things like a full thyroid panel, not just your TSH. I want to see the full picture of your thyroid health. Estradiol, FSH, and LH on cycle day 3 of your follicular phase. And then also, what does your progesterone look like about 7 days post ovulation? Testing your DHEA, testosterone, and cortisol rhythms. And then, of course, blood sugar and insulin markers. These are just to name a few. The testing I do with my clients is a lot more comprehensive. Even doing a Dutch test can be so informative in terms of what is actually going on with your hormones, the metabolism of your hormones. And then from there, you can choose personalized protocols to be able to begin shifting and balancing your hormones again. So when we put these pieces together, we can create a clear roadmap for rebalancing and restoring your body to its natural fertile state. So to quickly recap, the 7 signs of possible hormone imbalance we covered today are irregular or missing periods, short luteal phase, spotting between cycles, intense PMS, poor sleep, especially pre-period, low libido or dryness, hair loss, acne, or weight shifts. And if any of these resonate, it's definitely time to dig deeper, not just with labs, but with support that addresses your body and your nervous system. You deserve answers and you deserve solutions that are going to work for your body and your hormones. So until next time, trust your body, trust the signs and symptoms that your body is communicating with you, trust the process, and just know that you're not alone. And there's so many options outside of just jumping into fertility treatments if that doesn't feel right to you. So thank you so much for listening. I hope you have a beautiful rest of your day. And be sure to check out Thursday's episode where I'm going to be talking about a trendy hormone balancing herb and whether it's really the magic fix for hormone imbalances and fertility support.
Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.